Okay, this is going to be a three-part video. It's called 2018, My Year with Cancer. It all really starts at the back end of 2017, when I was first diagnosed. I had an appointment with a private specialist at the Saxon Clinic, Milton Keynes, on the 29th of September, recent painful piles. And after he stuck his finger up my arse, he informed me there was a blockage in the bowel. He said he'd refer me to the NHS for treatment, as it would be cheaper than going private. That's when the alarm bells ring. Probably a bit more serious than piles if he's referring me to the NHS. Should hear more in a couple of weeks. At this time, my weight is almost 13 stone. 5 days later, my GP sends a referral letter to Milton Keynes Hospital for an urgent appointment within 2 weeks. A couple of days later, a call from the hospital for an appointment to see a specialist in 4 days. Hospital appointment with the usual finger up the bum. Told I need to make an appointment for some suppositories, a flexible sigmoidoscopy, that's a camera up the bum, and some scans. Following day I went up to Wales and took whiskey to stay with my friend Jem while I had all these tests and scans. A few days later I left to go back home in the unknown, minus whiskey. Wednesday, 18th of October. I start taking the laxative supplied by the hospital. I later learned they call it dynamite, an appropriate name. The following day I had the sigmoidoscopy, painful, and they took some samples from some polyps to do a biopsy. Some lengthy interviews on the likely possibilities, and then home. 3 days later, the CT scan. 3 days after that, an MRI scan. Thursday, 2nd of November. Just under 5 weeks from the first finger of many to come up my arse, an appointment at Milton Keynes Hospital to see the specialist on the 6th of November. Friday, 6th of November, I'm diagnosed with bowel cancer. I'm told the good news is it hasn't spread anywhere else yet, and an operation is set for December the 6th, but I've got cancer. When you hear those words, it's like a kick in the bollocks. Obviously, there's no nice way of telling you, and the talk with a sympathetic cancer nurse afterwards doesn't really make much difference. You've got cancer. How many people do you know that have cancer? How many people do you know that have died of cancer? And to go with that, the surgeon casually mentions there was something with the bladder, but we can sort that later. Well, that's it then, I'm fucked. Something the nurse said to me after the diagnosis, while we had our little chat in the side room, was, "Are you scared?" Seemed a strange question to ask, I thought. "Not scared," I replied, I just don't want to die just yet. The next day I drove up to Wales and saw whiskey. I spoke with my friend and she said whiskey can stay with her for as long as need be, whilst I have all this shit sorted out. A massive weight off my mind. I know whiskey will be okay there, but Christ, I miss him terribly. He's all I've got and he means the world to me. The dog will always be by your side, no matter what. At this point in time, apart from a sore arse most of the time, my bowel movements are not the best either. Diarrhoea and shitting blood a lot of the time. I'm also pissing blood and have been for a while. Saturday, 18th of November, I drove back to Milton Keynes. Just over a week later, I have to go to the cardiology department at Milton Keynes Hospital for a dobutamine stress echocardiogram. Dobutamine is injected into a vein by a catheter, which then makes the heart feel like it's under stress from exercise. The idea is to see if my heart could cope under anaesthetic during an operation. Because of my heart attack in 2010, my heart is not that strong. I lost 40% apparently. The results were not 100%, so I had to have an ECG. I decided I would have to have an angiogram in a couple of days to see if I need any more stents to boost the heart's blood flow. Tuesday, 28th of November, I had the angiogram, which showed 2 of my 3 stents were okay. One was a bit iffy. I think it might be okay, but a second opinion was needed. So it was decided I should go to Bedford Hospital for another angiogram in case I need any more stents. They can't do stents at Milton Keynes. Next day, back to the hospital for a pre-op check and a chat with an anaesthetist to be ready for the upcoming operation. Somehow I don't think it will happen because of the outcome of the second angiogram at Bedford. Friday, 8th of December. Appointment at Bedford for angiogram, all went well. No more stents needed. However, this meant the operation was cancelled and had to be arranged for the 12th of December. The day before the operation, I'm told it's cancelled. Probably be in the new year now. A letter a few days later says operation will be the 24th of January 2018. Friday, 29th of December 2017, I drove up to Wales. It snowed. Saturday, 6th of January 2018, I drove back to Milton Keynes. My weight at the start of the year, 12 stone, 7¼ pounds. Wednesday, 24th of January, I arrive at the hospital ready for my bowel cancer operation. It's cancelled. It seems all my previous tests and scans are now out of date. Well, whose bloody fault is that, I wonder? They now want to look at my bladder. I now have bladder cancer too. Off to the urology department and the unknown. A bit nervous. I sit on the edge of the bed, a tight table, and a quick explanation of what will happen. Yes, I'll be awake. No, I won't feel a thing. An injection into the base of my spine, and very soon my legs start to go numb. I'm helped to lay down and wait while the numbness takes over my legs and lower body. My legs are lifted up and put into some sort of stirrups to keep them up. The doctor's fiddling about down there, but I can't see what he's doing or even feel anything. Forget about your dignity. Cancer has a way of very quickly taking that away. A quick operation to remove the cancer, and then I'm off to a ward with a catheter down the old Jap side, connected to a bag to piss in. 2 days later, the catheter is removed. Very painful, despite the young female nurse being as careful as she can. Now when I piss, it's like pissing fire and being kicked in the back. My piss is also the colour of blood. Very scary. Something I was totally unprepared for, and something I told the surgeon when they come and do their rounds. Why the fuck don't you tell people to expect some discomfort for a while? He listened, but I doubt it wouldn't make any difference. Something I would come to learn over the coming months. The surgeons may be brilliant at their jobs, but their bedside manner is non-existent. The nursing staff, however, are completely different. Brilliant at their jobs, sometimes taking some stick from awkward patients, but always giving a smile and some reassurance when you're scared or worried. Monday, 29th of January, I left the hospital. Into February, I'm in a lot of pain. Even the painkillers don't seem to help much, and I'm constipated. The nurse from the colorectal department at Milton Keynes Hospital rings to see how I'm doing. She was concerned that I was constipated and explains that I shouldn't really be taking codeine phosphate for the pain because it can make you constipated. Also, I should stop taking the movie cold for the constipation. because that could cause my shit to push past the tumour and tear the bowel. Strange. Both of these medicines were given to me by the hospital when I was in there and when I left. Things like this really fill you with confidence. She also mentions that the bowel operation could be done at Oxford. Following day an appointment at the urology department, it seems my bladder cancer has spread to the wall lining, meaning I will have to have the bladder removed. The dual operation to be done at Churchill Hospital, Oxford. Also got a urine infection, so a course of antibiotics, and I have to drink plenty of water. CT scan is arranged a few days later. I'm still pissing fire and now blood clots come out with the urine too. Sometimes they're quite large and I've still got blood in the urine. To add to all of this, when I piss I feel like I need to shit too. Sometimes a wet fart, sometimes a little blood. It makes going out very daunting. You never know if you shit yourself. I feel like I'm already being ground down slowly. I just wish it would all end one way or the other. Maybe some light at the end of the tunnel, finally. An appointment at Churchill Hospital, Oxford, to see the bladder surgeon. He explains that they'll be taking over from Milton Keynes Hospital now and all work will be done at Oxford. A double operation will be performed to remove the bladder, prostate and the tumour in the bowel. A high risk operation. A big operation.